position. Okay, this patient and operator position is also known as ergonomics. So what we do in patient and operator position is, this is how supposed to sit on the chair, okay, and how your hygienist will sit on the chair, and how the patient, the position of the patient also. So when we start our preclinical exercises on our phantom head, okay, we have to imagine the phantom head as our patient. We have to consider the phantom head is our patient. And then we have to work accordingly. Okay, so we have to set a rule. We have to sit according to the chair position of the patient. Okay, and our chair position should also be correct. So what can you see here? Anyone tell me, what can you see in this picture, in this photo? What all can you see? Okay, Pravesh, tell me what you see in this photo, in this picture here.
Patient and doctor.
Okay, patient, here's the doctor, and here's the hygienist. So this is the patient that we're going to operate on, this is the dentist, and this is the hygienist. So when we are working in this position, how many hands do we have? The operator has 2 hands, 1, 2. The hygienist, this is the hygienist that you can see here. The hygienist will always be at a higher level than the patient. 1 minute, let me admit these people. Okay, so this is the position of the dentist, this is the position of the hygienist, and this is the position of the patient. The patient is lying down on the chair. So how many hands are working here? Can you see? The dentist, he has 2 hands, okay, and the hygienist has 2 hands. So altogether we have 4 hands, okay. So this is known as 4-handed dentistry. If we have 1 doctor, let's say the dentist, and 1 hygienist working, then we have 4 hands. So it is known as 4-handed dentistry. Okay, and sometimes what we do is we work with 2 hygienists. That is 1 doctor and 2 hygienists. So if there is another hygienist along with this hygienist, then how many hands do we have? We have an additional of 2 hands. That will be 6-handed dentistry. Okay, this is 4-handed dentistry, 2 hygienists and a dentist, that will be 6-handed dentistry. If there is no hygienist and the dentist is working alone, that will be 2-handed dentistry. So in your BDS years, let's say in your preclinical years, in your clinical years also, when you work on a patient, you'll be working with only 2-handed dentistry because you won't be allotted a hygienist. You'll have to do everything by yourself. Okay, but when we work in our clinics, we sometimes work with 4-handed dentistry or sometimes with 6-handed dentistry. The more number of hands we have, the more efficient our work will be. Okay, so this is 6. So all of you understand what is 4-handed dentistry, what is 2-handed dentistry, and what is 6-handed dentistry. So let's go to the various chair positions, chair and patient positions. Can you see here? The patient is this is the dental chair, and the patient is sitting in let's say lying in a semi-reclined position. Okay, so this is something known as a supine position. Okay, this is a supine position of the patient. Just see how the patient is lying. Okay, when you work in your clinical years, let's say from 3rd year, 4th year, 5th year, you'll be doing patients. So your patient will lie on the dental chair somewhat like this. But for now, your typhodont, your phantom head is your patient. You have to take care of your phantom head. Okay, this is the patient. Okay, and this is a semi-reclined position. Okay, mainly the supine position. When we work on the mandibular quadrant, we have to work in this supine position. Okay. Okay, and when we work on the maxillary quadrant, then we'll be working in a semi-reclined position like this. Okay, the base of the mandible will be at 45 degree to the floor. Okay, so in in semi-reclined position or upright position, the base of the mandible will be at 45 degree to the floor. Whereas in this supine position, can you see? In the supine position, the base of the mandible will be parallel to the floor. Operating positions. Okay, so operating positions, tooth being treated should be at the same level of the operator's elbow. Okay, so operating positions, when we are treating the patient, what happens is the operator's elbow, all of you know what is an elbow, right? Your elbow should be at the same level of the tooth to be treated. If you are working on the mandibular quadrant, your elbow should be at the level of your mandibular occlusal plane. If you are working on the maxillary quadrant, then your elbow should be at the level of your maxillary occlusal plane. And we have different positions for right-handed operator and left-handed operator. Do we have any left-handers in this class? If so, let me know now only.
Yes, ma'am.
Yes, Shreya, and who else?
Roxanne.
Raksha, two girls only. Okay, for you people, we'll have different chair positions. That's why. Okay, this is for a right-handed operator. Just look at this picture only. First, look at this picture. This is for right-handed operator. Okay, so if this is your patient, so where do you sit? Okay, so for right-handed operator, watch. All of you know how to look at the watch, right? All of you have a watch. All of you know how to look at a watch or a clock. Okay, so just imagine this as a clock. Okay, this is a clock. Let's say this is a clock. So 7 o'clock. Okay, on your watch, just see 7 o'clock. So when you work, so 7 o'clock, this is your right front position. This is known as 7 o'clock position. Okay, 9 o'clock. This is where you sit. The patient will be lying supine or in a semi-reclined position. Okay, on the dental chair, this is the patient, and you, the dentist or the operator, will have to move around according to whichever quadrant you're going to work on. Okay, so let's just find out what are the quadrants that we have to work on. Okay, right front position. This is the right front position. This right front position is 7 o'clock position. It corresponds to the clock that you wear. Okay, the wall clock, let's say a watch that you wear on your hand. Okay, you just correspond it to the clock. Okay, and then we have 9 o'clock position. This is 9 o'clock position. This is the right position. Okay, then this is your 11 o'clock position. This is your right rear position. Okay, and this is your 12 o'clock position, which is a direct rear position. Okay, and we have 6 o'clock position also. But generally, you'll be working in 9 o'clock and 11 o'clock position. Most of the time, you'll be working in 9 o'clock or else 11 o'clock position. Okay, similarly, this is for right-handed operator. For a left-handed operator, what do we have? We have 12 o'clock position. Then instead of 11 o'clock position, we'll have 1 o'clock position. Okay, instead of 9 o'clock position, we'll have 3 o'clock position. Okay, and instead of 7 o'clock position, we'll have 5 o'clock position. Okay, these are the different positions. Okay, see, for left-handed operator, I told you we have 5 o'clock position, 3 o'clock position, and 1 o'clock position. And this direct rear 12 o'clock position is for both-handed operators, both right as well as left-handed operators. Okay, so that is how you sit on your dental chair. Okay, direct rear position. And this is your direct rear position, which is 12 o'clock position. This is both for right-handed as well as left-handed operator. The direct rear position is used primarily for operating on the lingual surface of mandibular anterior. For lingual surface of mandibular anterior, you will work in 12 o'clock position. The operator is located directly behind the patient and looks down over the patient's head. Okay, the operator will be sitting directly behind the patient and will look down over the patient's head. This is direct rear position, which is common for both right-handed as well as left-handed operators. So now let's go to the different operating positions. Okay, so right front position. So this is the right front position. Can you see right front position is your 7 o'clock position. Okay, so right front position, this is your 7 o'clock position. So just look at the operator here. Okay, operator is standing in a 7 o'clock position. So in which cases do you work in a 7 o'clock position? You work in a 7 o'clock position for the mandibular anterior tooth. Okay, when you are operating on the mandibular anterior teeth, mandibular posterior teeth, right side, on the right side of your mandibular posterior teeth, that is your 4th quadrant, right? Maxillary anterior teeth, for maxillary anterior teeth, okay? The head of the patient slightly rotated toward the operator. When you work, the head of the patient will be slightly rotated towards the operator. So right front position or 7 o'clock position. So when do you sit in 7 o'clock position? When you operate on the mandibular anterior teeth, okay? Mandibular posterior teeth on the right side, maxillary anterior teeth, okay? And the head of the patient is rotated slightly towards the operator. This is your right front position. Right position. Right position is your 9 o'clock position. As I told you, right position is your 9 o'clock position. Okay, so 9 o'clock position. So when do you work in a 9 o'clock position? Okay, right, operator is directly to the right of the patient. Can you see here? 9 o'clock position. The operator is directly to the right of the patient. Directly to the right of the patient. So you work in 9 o'clock position when you are working on facial surface of maxillary and mandibular right posterior teeth. Okay, when you work on maxillary and mandibular right posterior teeth, occlusal surface of mandibular right posterior teeth. Okay, on the occlusal surface of mandibular right posterior teeth. So basically, most of the time you'll be working on 9 o'clock position and on 11 o'clock position. Okay, so right position or 9 o'clock position. The operator is directly to the right of the patient. You can see the operator is directly to the right of the patient. So you work on this position when you work on the facial surface of maxillary and mandibular right posterior teeth, the occlusal surface of mandibular right posterior teeth. Okay, so this is your right position. Right rear position. Can you see here? Right rear. Right rear position is your 11 o'clock position. Okay, right rear is 11 o'clock position. Okay, position of choice for most operations. Most of the teeth that you operate on, you will have to sit in a 11 o'clock position. This is the position of choice. The operator is behind and slightly right to the patient. Can you see? The operator is behind but slightly right to the patient. Okay, in an 11 o'clock position. The left arm, whenever you work, your left arm should be positioned like this, around the patient. Okay, the left arm is positioned around the patient's head. Indirect vision, that is when you work on the maxillary quadrant, you'll be looking at your mouth mirror. Okay, looking at the mouth mirror, you have to work on the maxillary quadrant. You won't visualize the maxillary quadrant directly with your eyes. For the mandibular quadrant, you can directly see the teeth, but for maxillary teeth, you have to reflect the teeth on the mouth mirror and view the teeth from the mouth mirror. Indirect vision and incisal surface of maxillary teeth. Direct vision, left mandibular posterior teeth, mouth mirror for visibility, right reflection and retraction. Okay, right rear position is your 11 o'clock position. This is the position of choice for most operations. The operator is behind and slightly to the right of the patient. The left arm is always positioned around the patient's head. Okay, around the patient's head. So when you operate on the maxillary teeth, you'll be working in indirect vision. Everything will be reflected on your mouth mirror. Indirect vision, lingual and incisal surface of maxillary teeth. Direct vision, left mandibular posterior teeth. Okay, So this is your right rear position. The position of choice is your right rear position and right position. That is, you'll be working in 11 o'clock and 9 o'clock position, direct rear position. I told you direct rear position is 12 o'clock position. So you'll be working in, you'll be right directly behind the patient. The operator is located directly behind the patient and looks down over the patient's head, okay, like this. Lingual surface of mandibular anterior teeth. Okay, you can work on the lingual surface of mandibular anterior teeth. See, whenever you're working, you should work like this. In one hand, in your left hand, you'll always have your mouth mirror and you'll have your handpiece on your right hand. And always your left hand should be around the patient's head. Okay, now operating stool. All of you have seen an operating stool. When you did your plaster model exercises, you used to sit on the operating stool. Okay, this is an operating stool. Well-padded seat. The operating stool has a well-padded seat. It has a backrest here. Okay, well-padded seat with smooth cushion edges and adjustable backrest. This is the adjustable backrest. Should be adjustable forward, backward, as well as up and down. This operating stool, I don't think I have to tell you about because you've been sitting on the operating stool for 1 year already. Now look at the operator position. Just look at the first picture. See, the operator is stooping. Can you see? The back is curving like this. And see, it looks like the patient is resting on the operator's lap. You should not work like that. Your back should always be straight. See, your back should always be straight. And there should always be a distance between the patient's head and the operator. Okay? And your foot should be flat on the floor. Just look here. Foot should be flat on the floor. Your thighs should be parallel to the floor. Okay, this is how you should work. Back should be straight, thighs parallel to the floor, and foot flat on the floor. And you should always have a distance between the patient and the operator. The patient should not be sleeping on your lap or something like this. Okay, the operator should, and then you should, and you should sit on the full cushion of the chair. Okay, you should not just sit on this, on the edge of the chair also. If you sit on the edge of the chair, again you'll have some problem. Okay, and your back should rest on the backrest always. Operator sits back on the cushion using the entire seat and not just the front edge. As I told you, the entire seat should be used, not only the front edge. The upper body should be positioned so that the spinal column is straight or bent slightly forward and supported by the backrest of the stool. Okay, so your back should be straight. It should be supported by the backrest of the stool, and you can slightly bend a little forward, but your back should be straight and you bend forward, not stoop like this. Thighs should be parallel to the floor. I told you thighs should be parallel to the floor. The lower leg should be perpendicular to the floor. Okay, this lower leg should be perpendicular to the floor. Okay, and should be perpendicular to the floor. If the seat is too high, it cuts off the circulation to the floor, to the user's leg. Feet should be flat on the floor. Okay, so if the chair position is too high, what you tend to do is you tend to sit on the edge of the chair. So when you sit on the edge of the chair, what happens is there will be poor circulation in your legs. Then you'll have problem later. Okay, and if you stoop like this, if you work like this, you'll end up with back problem. So how should you sit? Your back should be straight. Okay, always on the backrest. Thighs parallel to the floor. This lower leg should be perpendicular to the floor. And this foot should be flat on the floor, always. So you have to follow all these things when you work on the phantom head. Assistant position. So this is your assistant. In your phantom head, you won't have an assistant, but you have to know what is the position of the assistant. The same for the operator, except the stool is 4 to 6 inches higher for maximum visual access. Okay, the assistant position is also same as the operator, but the operating stool of the assistant should be 4 to 6 inches higher than the operator. You can see the level here. The assistant is always at a higher level. Why? Because she has to see the operating field properly. Okay, stool for the assistant should have adequate footrest so that a parallel thigh position can be maintained with good foot support. Factors to be considered. Can you see, when you work on a patient, there should be adequate distance between the patient and you. Okay, the operators, the distance should be like reading a book. When you read a book, you have to maintain some distance, right? You don't read a book close to your eyes. Okay, the distance that you maintain while reading a book, the same distance should be maintained while you work on a patient. Okay, like this. Operator's face should not come too close to the patient's face. Ideal distance similar to that of reading a book should be maintained. Minimize body contact with the patient. You should not touch the patient. Body contact should be minimized. Operator shouldn't rest the forearms on the patient's shoulders, face, or hands or face. Okay, your arms should not rest on the patient's face, on the patient's head, on the patient's body. There should be enough of space between the patient and the operator, and the distance should be as reading a book. Patient's chest should not be used as an instrument tray. So sometimes what people do is, what some operators do is, while working, instead of placing the instruments on the instrument tray, they place it on the patient's chest. So that should not be done. Left hand should be free to hold mouth mirror to reflect light to the operating field, to view the tooth preparation indirectly, or to retract the cheek or tongue. Okay, so left hand should be free. As I told you, in your left hand you should have your mouth mirror. The use of mouth mirror is for what? For retraction of the cheek, for indirect vision, for reflection of light, for retraction of the tongues. So your left hand should always be free, and you should have your mouth mirror in your left hand. Changing positions, if only for a short time, reduces muscle strain and reduces fatigue. That is, if you are tired, you can just move around for some time. Zones of working area. Now again, you have to manage your clock. You have to imagine your clock again. Operator's zone is from 7 o'clock to 12 o'clock. Assistant's zone is from 2 o'clock to 4 o'clock. Static zone is from 12 o'clock to 2 o'clock. Transfer zone is from 4 o'clock to 7 o'clock. So operator's zone is the zone in which the operator will always be working. That is from 7 to 12 o'clock. Okay, this is for right-handed operator. For left-handed, it will be from 12 to 5 o'clock. Assistant's zone. Assistant's zone is where the assistant works. The assistant will always work in 2 o'clock to 4 o'clock position. Okay, the assistant will always work in 2 o'clock to 4 o'clock position. The assistant won't stand behind you. Static zone. 12 o'clock to 2 o'clock position is static zone. That is the free zone. Okay, from 12 o'clock to 2 o'clock position, no operations will take place. Transfer zone. Transfer zone is from 4 o'clock to 7 o'clock position. That is, in this transfer zone, we can transfer instruments. The assistant can give you the instruments from the transfer zone. This picture is not clear, but you can see here. This is the operator zone here. Okay, this is the static zone. This is the assistant zone, and this is the transfer zone. Any instrument should be transferred from the transfer zone. We're not supposed to transfer any instruments directly over the patient's head. Okay, we're supposed to transfer from the transfer zone. Instrument exchange. Exchange zone below the patient's chin and a few inches above the patient's chest should not be exchanged over the patient's face. Any sharp instrument should be exchanged with appropriate deliberation The assistant should take the instrument from the operator rather than operator dropping it into the assistant's hand. So whenever instruments are exchanged, you should hand it. If you are going to transfer any instrument to the assistant, you have to directly give the instrument to in the assistant's hand. You're not supposed to just drop it. Okay? And if the hygienist is going to give you any instrument, your hygienist or assistant, then she should give you the assistant directly into your hand rather than just dropping it in your hand. So what are the magnification and headlamp illumination? All of you have seen. Okay, in your typhodont, what do you have? You have a light. Okay, that is for your illumination, right? When you turn on the light, your operating field will be illuminated. Okay, so we have certain. So when we work on patients, when we work on typhodonts also, we can use these magnifying loops. Can you see? The operator is wearing a magnification on the operator's eyes. These are known as magnifying loops. Okay, these are your magnifying loops. And here is a torchlight also for added illumination. The key to clinical operative dentistry is visual acuity. That is, if you can see a magnified version of your tooth, then what can you see? You can see these minor details of the tooth. If there is any caries, if you have to modify anything, you can visualize the minor details, and your skill will be enhanced. And this is the torchlight. Let's say this is a torchlight. This is a light which for added magnification. So magnification, can you see? These are the loops which are placed. Facilitates attention to details and does not adversely affect vision. Magnification devices are bifocal eyeglasses, surgical loops. These are your surgical telescopic loops. Okay, we have different types of loops. Advantage. Magnifying lens have a fixed focal length that often requires the operator to maintain a proper working distance that ensures good posture, protection from eye injury. Okay, there will be protection from eye injury. Increases visibility of operating field. Okay, the operating field will be magnified, so there will be increase in visibility. You can see the minor details and then you can perform a better work. Headlamps, as I told you, these are your headlamps. Okay, they can be attached to your magnifying loops, or I think this one, there's no magnifying loop. This headlamp is again for added illumination. Advantage. The light source being parallel to the clinician's vision, eliminating shadows at the operating field. Current headlamps use light emitting diodes. Okay, they use light emitting diodes, LED technology, and produce whiter light than conventional tungsten halogen light sources. Okay, so these are different headlamps, and then we have dental operating microscopes also. So what do dental operating microscopes do?